Hi, this is Donald. I had my open heart surgery 2 weeks and this is my 2 week update video. My voice is a little bit weak still, but I figured it's good enough to make this video now. So a couple days prior to open heart surgery, I went to the hospital for some lab work and x-rays. But other than that, I just, took a special shower with some special soap the night before, and my parents dropped me off at the hospital. No visitors allowed in the hospital, so that was the last time I saw my family for about 5 days. The day of the surgery, I arrived at the hospital at 6 in the morning, a little earlier than that actually. And the Heart and Lung Center, I think it's called the Cardiothoracic Surgery Center, was pretty busy because I think that's when they check most of their patients in. They just, prepare them and put them in rooms until surgery time. There was only one other person there who was also having open heart surgery though. I think everyone else was having more minor surgeries. And they took me to this room, a large room where it was almost like jail cells, but instead of jail cells, it was hospital patient rooms, and they had the nurse station in the center and just dozens of hospital rooms around it. I changed my clothing, put my personal stuff in a bag, signed some paperwork, and talked with the anesthesiologist. Then they shaved all the hair off my body pretty much, gave me some medicine, put in an IV. But I don't think they gave me anything through the IV at the time. Then, after a bit, they just carted me off to the surgery room, and that's actually the last thing I remember. I remember entering the surgery room, and I don't remember anything else. I just kind of woke up the next day. I don't remember getting injected with anything that made me numb or fall asleep or anything like that. That's the last thing I remember. I woke up about 12 hours later, and I didn't have a breathing tube down my neck. I was just breathing by myself. I was really just kind of chilling in bed, and I had these big sock compressor machines that were compressing my legs back and forth, which I guess was to keep any clots from forming in them or anything bad. They kept waking me up over and over again for finger pricks to check my insulin. And I must have had my insulin level checked like 15 times at the hospital or something like that. Apparently it's a big concern for heart surgery. And they gave me painkiller whenever I asked for it, or I never asked for it. They just kind of always asked me. But I never actually felt much pain at all. I did feel dizzy or groggy, which later I understood was a side effect of the painkiller. But I didn't know that, so they would give me painkiller, and I'd be like, yeah, I still feel kind of bad. So they gave me more painkiller, but it was just because a side effect of the painkiller. But overall, I didn't really ever have any or much pain at all at the hospital. They gave me some medicine for nausea, which helped a little bit. And I believe the first night, I stood up and shifted to the chair next to the bed. And I had a catheter attached too, so I didn't have to worry about the bathroom. So I stayed at the hospital for about 4 days, and time was a little bit hazy there because I would sleep during the day and the night, and time just seemed to go really slowly. And it was a little bit hard remembering what day it was or what time of day it was, which got better and better. I think it was a side effect of the anesthesia. I didn't really bring anything to do, and frankly, I wasn't in the mood at all for reading or anything intellectual or deep thinking. Originally I thought, this would be a good idea, a good time to think about life and reflect on life. But no, I wanted to be a potato, and I was a potato. Like, no thinking aloud. Eventually I started taking some walks around the hospital ward, but 99% of my time was spent in bed. And after they removed my catheter, I spent a lot more time in the bathroom. And they give you a lot of medicine to try and make you go to the bathroom, just because your body is kind of restarting after the surgery. So, they need to make sure your lungs are good, your heart is good, that you can walk, that your digestive system is working as well. So it's kind of like a checklist of stuff to make sure that you're restarting properly. And for the most part at the hospital, I could barely eat anything besides yogurt, applesauce, and a really small amount of just normal hospital food. I felt a little bit nauseous, so I didn't have much of an appetite. The biggest pain and discomfort at the hospital wasn't my surgery, actually, or the medicine or anything like that. It was my neck and shoulders. It was they were so stiff and painful. I mean, I guess the way I slept in bed or something, they were super stiff. And the worst thing done at the hospital is after surgery, I had wires sticking out of my chest and all these IVs, and I had 2 tubes in my chest to drain out the fluid. And when they pulled that out, the nurse kind of just I think it was a physician's assistant, she kind of yanked it out really fast, and that was painful. Taking out the pacemaker wires, a catheter, all that other stuff wasn't actually bad at all. When the nurse removed the IV in my neck, there was an IV in my jugular, a big one. He had to put a ton of pressure on it for 20 minutes because, it's your jugular vein. And man, that also was very painful. It was really hard to get comfortable, and I had to switch between standing, sitting in bed, sitting in a chair, being in the bathroom. Bathroom was a nice relief when I could do it. And for the most part, I just sat in bed or slept or watched TV and just kind of kept myself mindless and numb. No capacity for thinking, right? Your brain is still restarting too, in a sense, I think. Personally, for me, it wasn't a very contemplative time. It was just trying to survive each day and get better a little bit. But it wasn't a terrible experience or anything like that. It was surprisingly easy besides the neck and shoulder pain. The nurses at the hospital were generally really good and impressed me a lot. But not every nurse, right? Once in a while you had a nurse where even though you were in the ICU, she'd only check on you once every 4 hours or something. And it's like, well, of course I need something, right? And she just wouldn't check up. Most nurses, you push the call button, they come pretty quickly. And I did have one nurse where I pushed the call button and it'd be like 30 minutes before someone came. And it's like, well, what's the point of having a call button then? At my hospital as well, I was in the ICU the entire time, the entire 4 or 5 days after the surgery. That was just their standard of practice. I didn't really struggle with sleep either. And I was pretty drugged out for the most part, I believe. By the time I left my hospital, I was eager to go home. But it wasn't like I felt overwhelmingly healthy or something like that. I figured it would take a lot longer to heal, and home is just way more comfortable. The day of my discharge, I finally met my family, and they prepared my room and bought balloons and a stuffed koala plushie for my bed, which was awesome. And I took the stairs to my room really slow, and I even took a break in the middle. I'm young, so my muscles are capable of running up the stairs easily, right? But I didn't want to blow up my heart accidentally by doing something like that. And I never practiced stairs in the hospital either, so I just didn't want to push myself too much. I had no appetite when I went home, and the first night I slept okay and made it through the night. However, I kept taking the pain medication, and then now I started to feel much more nauseous, so I had to stop taking the pain medication after I threw up and just had the most miserable night of my life. Not taking the pain medication seemed to help a lot, and nausea went away, and my appetite also started to come back as well. My second night at home, though, was the most hellish night of my life, though. It just tons of nightmares. I couldn't sleep at all, pained, felt sick. It was a long, long night. So eventually the painkillers wore off and I could feel my chest soreness more. There wasn't much pain, just soreness. And I started to take slow walks and do some breathing exercises. But mostly I sat down and laid down and relaxed with games and TV and just not doing anything. My mind still wasn't in the mood for anything intellectual or deep or anything productive, really. I was still in survival mode. Walking really tired me out, and the end of each day I was really exhausted. The first week I couldn't sleep on my back, so I started to sleep on my family couch each night. It just felt painful and awkward to sleep on my bed. A couple of days ago, I started to sleep on my bed again, with an extra couch pillow, so I'm not quite lying flat on my back yet. And I also wear a neck pillow, which is helpful. My neck and shoulder and back pain topped out about a week ago, but now it's starting to subside and it's becoming much more manageable and not too painful. And I took off my surgery bandages and I'm starting to feel a lot better now. I'm still weeks and weeks out from recovering though, so just taking it easy. I still have to remind myself to take it slowly. About a week ago, or a couple days after I came home, I tried to cook something, and I wasn't even stressing my body out too much, but I started bleeding from my stomach, so I had to stop and sit down, and thankfully it stopped, but it just was a reminder to me that I need to take it slowly, and be extra generous with laying in bed and just relaxing. Also, I had to start taking some blood thinning medications and going to the I&R clinic, which is a coagulation clinic right next to the hospital. And that has been pretty easy so far though. Overall, this second week, well, the first week was a hospital week and the second week was outside of the hospital. Second week has been full of a lot of ups and downs, but I'm starting to trend mostly upwards now, where the days are starting to become better and better and better. But there are definitely some ups and downs during that second week where you feel great or you feel bad, and then it just goes up and down, sometimes multiple times in a day. So currently, the hardest thing for me to work on right now is coughing, actually. Only a couple days ago or a week ago, I started to cough, and my voice is quite weak. And that's not a bad thing that you're coughing, because you're keeping your lungs clean, basically. But it also leads to a weak voice and can be quite painful to cough too sometimes. So I have to use my heart pillow quite a bit. And that is my story of 2 weeks after open heart surgery. Hopefully this is helpful for someone, and especially for people my age who are in line to get the surgery done. Thanks.